So our presenter today is Patti Barovechio, and she is a nurse with the Bureau of Family Health. I'm going to let her tell you more about herself and her credentials when she starts, but we consider Patti to be the guru when it comes to youth health transition in Louisiana. She has developed an excellent website that I'm sure she'll tell you about, and it's just a great resource for parents and young adults as you start planning that transition to adult health care. So, Patti, thank you so much for being here today, and we look forward to hearing what you have to say.
Well, thank you for the opportunity to talk about transition. As you mentioned, it is a subject near and dear to my heart. And so just to walk you through what we're going to do over the next hour, we're going to talk about why am I here and why am I talking to you about youth transition. We're going to define it. We're going to talk about what does supported transition mean or look like, and then why it's so important to our young citizens in Louisiana, and then how to start youth transition planning and connect to those supports that are important to a successful transition. So about me, I work under the Louisiana Department of Health, under the Office of Public Health, and then the Bureau of Family Health. So I'm technically a statewide nurse consultant, and I have been working in this space for about 11 years now. And so the connection between public health, Title V, and youth transition is just kind of a little bit of a historical lesson, but the Bureau of Family Health administers what we call the state's Title V grant, and that includes children and youth with special health care needs programming. So Title V is a state and federal partnership that, believe it or not, dates back to 1935. And through a block grant administration, the Maternal and Child Health Bureau delivers funds to states based on formulas like the population, number of children in poverty, and that type of thing. And basically the Federal Bureau's work is designed to strengthen public health systems to meet the needs of America's mothers, children, and their families. So every state, every 5 years, Title V programs are required to conduct a statewide needs assessment to learn about the health priorities and needs of our families. And at least 30% of the allotted Title V funds that goes to the state, and that's in every state, goes towards children and youth with special health care need program. And then another 30% of those funds are budgeted for preventative and primary care services for children. So in Louisiana, access to high quality comprehensive primary care is a priority area that we've identified for Louisiana's children, and especially children and youth with special health care needs. And under this umbrella, of which we call a pediatric medical home, includes strategies to increase access to youth transition services and teens. So for all practical purposes, that is why I am here talking to you today about transition. And so just kind of to level set everybody, when we talk about youth transition in the healthcare arena, we mean it is the process of moving from pediatric healthcare services, family-centered care, to an adult patient-centered model of healthcare. And we'll define that a little bit more and tease it out as we go along. But when you're talking about adolescent development, very similar, but it's the movement from adolescence to adulthood in all aspects of life, including home, healthcare, education, and community. So there is a National Center on Healthcare Transition. They use the acronym HCT. And it aims to improve the transition from adolescence to adult health care through evidence-driven strategies, meaning that what researchers have found to be effective in supporting teens as they transition from adolescence to adulthood. And GOT Transition is a program of the National Alliance to Advance Adolescent Health. And if this works, let me know if it jumps the screen properly. But I'm bringing you to the GOT Transition website on the youth and young adult section. There's a cute little video that's very short that if it loads, I was going to play, but it looks like we're buffering at the moment. I may have to come back to that, or you can watch it, but it's, all right, thinking about it really hard. And I don't know that it's gonna jump. All right, it's starting to load. I apologize. I could have possibly set it up as another screen. Somebody's gonna have to give me a thumbs up when it loads, if you're seeing the Got Transition website or if you're still seeing my slide.
Right now, we're still seeing your slide.
Well, this worked really well this morning. I guess when I got here at 7 o'clock, there wasn't everybody and their brother on the internet. So it's still thinking about it. So we might go ahead and, oh, all right. Can you see, I am now at the Got Transition website. Can you see that, or are you still seeing slides?
We're still seeing slides.
Let's see. I hope I don't hate myself for doing this. I'm gonna go to sharing this screen. So this is the youth and young adult. Hopefully, are y'all seeing that now? Got
There it
transition?
is. Yeah, we're on
Okay.
that website now, youth and young adults.
So this is the youth and young adult page on the website. It has information for parents and caregivers, all of the most recent research, if you're doing a project, if you're a professional or someone who's just doing a training for families, there's a lot of great information on this website. But it really, it's a great resource. So there's a ready to transition to adult healthcare for teens to take. There's a frequently asked question list. And then you can see down here, there's some other links. And what I'm hoping to play for you, if this loads, is this very short little video. It's about 2.5 minutes, and it just kind of gives you a great overview of what is healthcare transition and what does it mean to you. And so after all of this, I hope the video will come through. Are y'all seeing a pop-up screen?
Yeah, we're seeing now it says start now.
No, I don't want to, I want to skip the ad. I don't want to go to the online store. All right, let's see if it can play. This is always a kind of a crapshoot to see if the technology is going to cooperate.
For many young adults, transitioning to adulthood can mean going to college, finding a job, or moving out on your own. This can be exciting, but also really challenging. One transition that you may not have thought about is healthcare transition, or HCT, which means moving to an adult model of care where you are the main person in charge of your health. HCT is not a single event. It's a process that can take several years. Learning about your own medical history is the first important step. So ask your doctor how to access your health information. A major part of HCT is learning to manage your own health and healthcare. To start, you can make your own doctor's appointments, fill your own prescriptions, and talk with your doctor alone. After you turn 18, your doctor can only legally talk to you about your health. Your health information and medical records will be kept confidential. It is up to you to make your own health choices. You can decide, for example, if you want your parents to see your records or be in the doctor's appointment with you. For those who see a pediatrician, HCT also means moving from your pediatrician to an adult doctor. This usually happens between the ages of 18 and 22. Some people see a family physician or a doctor who sees patients throughout their life. If you see a family physician, you'll need to change who makes your health decisions, but not your doctor. In an adult model of care, you, and not your parents or caregivers, are in charge of making decisions about your own health. To plan for this transition, talk to your doctor and ask them about their policies. If you see a pediatrician, ask them when you need to leave their practice. You can also ask them to help you find a new adult doctor to move to. HCT is all about independence and empowerment, so be proactive. Find an adult doctor who's accepting young adults into their practice and takes your insurance. And don't forget to encourage your friends to be proactive about their healthcare transition too. For tips and resources to make your healthcare transition as smooth as possible, go to gottransition.org.
And again, it's a really great resource for families. I do
When I was accepted to SGU,
find it hard to navigate, and of course now I'm trying to
faculty at SGU really have helped mold.
navigate back to my original PowerPoint. So let's see if I can get back there. Are we back to my PowerPoint?
Yes.
Okay, great. So the link I have on this, which you'll get, will bring you right to that little video. I just think it's a great summary and kind of covers a lot of space and kind of gets everybody level set about exactly what is the topic of transition. And so when we talk about transition, we also have to look at it through the lens of adolescent development. And without any other barriers, this is a very complex period of development. We know it overlaps typical physical, emotional, and social development. We know that our brain continues to develop, and the rational part of our brain is not fully matured until about age 25. During this time, we're going through sexual maturity and puberty. Young adults are becoming more self-aware. They're really seeking to identify themselves as a person. And then also to compound these things just a little bit more, we know of adolescents aged 10 and 19, 1 in 7 are impacted by mental disorders. And overall, chronic illness or disability of any type will definitely intensify the complexity of youth transition. And then for our teens that have just experienced the last 3 years of COVID-19, we have to look at that through the lens of transition. So during this time, teens missed well visits, health education, opportunities, all types of screenings that would have occurred in those visits. They missed the services, therapies, and transition supports and planning that happen in the school system. With the restrictions, they were isolated. They were required to do virtual learning. A lot of these very important milestones, they missed them. So if many of us, at least my age, we can immediately recall what happened at our senior prom, or the feel-good moments and that occurred as part of our graduation. And many of these young adults miss those really important events. And then, of course, increased online activities put teens at increased risk for online harm, such as cyberbullying, online risk-taking behavior, and exposure to potentially harmful content. And then, of course, COVID-19 had many associated job loss that really impacted family income. And so a lot of extra stressors were placed on that family unit. So when we talk about adolescent health risk, we know that typically adolescence should be the healthiest time in an individual's life, yet we see that disease and death rates increase 200 to 300%. Teens are challenged to assume that responsibility for health and life decisions during late adolescence, yet we're knowing that the rational part of their brain is not fully matured. And then we also know that the top 3 causes of death among adolescents aged 12 to 19 are preventable, and those are accidents, homicide, and suicide. For those of you who live in the greater New Orleans area, there isn't almost a day that goes by that we do not have a report of a teen death on the news. It's really sad to think that these children did not have an opportunity to even begin their life. And so they were, at the springboard of great things happening, and because of a violent attack, that they have lost their lives. So a lot of things for us to think about a lot about our community policies, promoting community safety, and all of those things also touch youth health transition. So what we know about youth health transition, so researchers have been looking at youth transition for many years. After the 60s, when we started seeing really significant improvements in outcomes for children with special health care needs, we started accumulating this new population of youth with special health care needs. And they were doing well, and all of these new medications, new treatments, new surgeries, new DME, all were really supporting these children to live very healthy early childhood period. And we started noticing that as these youth started transitioning from that young adulthood, and during this transition period, we started seeing gaps in care, non-adherence with treatment regimens, or leaving care altogether, increased morbidity and increased mortality across all childhood illnesses and disabilities. There was an article in the Advocate a few years ago specifically talking about youth with special healthcare needs that had mental health conditions, and about the percentage of youth that stopped taking their medicines because for various reasons, they didn't want to be different. They didn't want to have to take a medication to function. And so cold turkey, they went off to college and stopped taking their medications. So there's a lot of things to be considered and think through about the importance of supporting these transitions. Unfortunately, in our state, according to the National Survey of Children's Health, only about 12% of our kiddos meet the criteria for what the National Survey considers the services necessary to make the transition to adult health care. So we have a good way to go. So that means over 80% of our kiddos are not getting the supports they need to successfully transition to adult health care. And if you want to look at the population, we know that about 30% of Louisiana's youth age 12 to 17 have a special health care need. So if there's one population that it is super important for them to have a supported transition, that is the one. So I've talked a lot about, the statistics and what it is. So let's talk about, when we're talking about youth health transition supports, what do the experts recommend? What is youth health transition support look like? So first and foremost, it's guidance on sexual health and personal safety. We know that homicide, suicide, and accidents, right, are the top leading causes of death. So this is just primary to their health. Education on chronic condition management and self-care. If they have a health condition, they need to learn about it. Building of health literacy skills, guidance and support for mental and emotional health. Plan for legal changes at age of maturity and future independent living. Additionally, exploring personal interest and recreation. And for those of you who are part of the Families Helping Families organization, we do a community survey, and time again, we see that this is a need in our community for recreation for individuals with special health care needs or with disabilities. So just finding hobbies, exploring personal interest, and finding opportunities to integrate into your community. Support academic achievement. Does this youth need accommodations or an IEP to be successful in school? Instruct on how to navigate the health system and advocate for services. Establish a plan for supported decision-making if needed. So if an individual has a developmental disability, and we'll talk about that in a minute, is that there are different ways to ensure that that individual will have the supports that they need going into adulthood. Identifying adult health providers and transfer to those providers, and then actually integrate into adult health care and preventative health care services. So why YHT? So why am I here talking to you? I think we've kind of laid the foundation for it in the previous slide, but really we look through the lens that every teen in Louisiana should have the opportunity to achieve their optimal health outcome. And the leading 3 causes of death for adolescents and young adults are preventable. So that in and of itself should drive a lot of these youth health transition efforts. Ensure teens access and use preventative healthcare services. Support development of healthy lifestyle habits that will impact lifelong health. If we don't start smoking at 15, then we don't have to quit at 30. If we don't start engaging with illicit drug use, then we don't have to deal with the eventual complications that this may place on someone's health and well-being. And then identify adult health providers who are qualified and can support the navigation to adult health care services. So, and let me just say this, sometimes you might go to a health provider, and if that adult health provider is not a good fit, I would always advocate for individuals to find somebody who is. If you don't feel like you're being heard, or if you don't feel like you can build a relationship with this provider, please find someone who will. And if you need help with that, things like family resource centers, your insurance plans can help you identify alternate providers. So when we talk about youth health transition, preventative care is really kind of the foundation. Annual well-care visits during adolescence promote healthy behaviors, they prevent risky ones, and they detect conditions that can interfere with physical, social, and emotional development. It's just like in early childhood. If there is an issue or something going on with your youth, we want to know early so we can intervene and prevent problems. So that's why these well visits are really important, and they are the mainstay for youth health transition services. And just some other statistics, I checked the Medicaid website, and in 2021 in Louisiana, only 47% of teens that are covered through a Louisiana Medicaid MCO attended a well care health visit. So that's a missed opportunity to get a lot of really great information. So that goes to now the how, like how do we start? What do we think about? What do we do? And again, it starts with care in a pediatric medical home. And what I mean by a pediatric medical home, that primary care provider, that usual source of care, that they have an opportunity to build a trusted relationship with that provider. And then hence, it will provide a safe environment for teens to practice communicating with health providers. I know, especially I have 4 children. 3 out of 4 children had really significant social anxiety. So it was very difficult for them to speak up. And a lot of times when they were asked a question, they deferred it back to me. So again, it takes practice, and these well child visits are the place that it can happen. And then work towards that private time between teen and health providers. In the Got Transition video, they talked about that. This gives them an opportunity to discuss things that they may not be comfortable talking about in front of mom, grandma, or their caregiver that's in the room. So when they're ready, when they're developmentally prepared, that the parent or the guardian should step out of the room and allow them some private time with their health provider to ask some very personal questions. And then we need to make sure that everyone, parent, teen, young adult, understand that health includes not only physical, but mental, behavioral, and sexual health. A lot of times, there's a lot of stigma often associated with mental health conditions, and we've got to do our best to remove those biases. When we talk about health, you cannot take the head off of the body. Mental health is health. So if you're having stress, if you're having anxiety, if you're having depression, a mood disorder, those conditions need to be addressed for you to reach your optimal health. Support discussions around future education, vocation, recreation needs, personal goals. So again, when we talk about a medical home, they should be addressing healthcare from a very holistic environment. It's like our Family Resource Center here at the Bureau of Family Health. We will help a family with almost anything because we realize that all of these things do have an impact on that family's health and well-being. So if you're having a concern in school, that is something to bring to your provider. There may be some type of accommodation they can recommend, write a letter to the school, help to navigate the school system. So again, lots of supported discussions around what those the future will hold. And then again, identify adult providers before disengagement with pediatric providers. You don't want to be told like, this is your last visit here at this provider. I personally experienced that with one of my children, going to a gastro specialist, and in this health system, they stopped seeing patients at age 18. And we happened to have a visit right after her 18th birthday. And our youth transition support was, oh, you're 18, so this is your last visit with us. It's been great treating you. And that was it. So just to say, this is an opportunity for us to advocate, and that brings us to like, what are everybody's roles in youth health transition? So as a caregiver, you're working with that provider and with your teen to shift that responsibility of managing health and healthcare to your teen or young adult. We want to maximize their independence and work to maximize their abilities. So sometimes I know as a parent, I was not exactly comfortable with silence. And I distinctly remember one of my children's pediatric providers, he would directly ask questions to them, and they had social anxiety, and they would turn and look at me. And of course, rather than being comfortable with the silence, I would jump in and answer the question. That was not the right thing for me to do in supporting that shift in responsibility. And over time, I had to catch myself. I actually learned, I had just come into public health at the time, and I actually learned to step back and just have to sit on my hands and close my mouth and be quiet and let the provider re-ask the question if needed. And then eventually they came around to answering the question. So they actually began to one-on-one interact with the provider, which was the goal. And then for teens, it's to improve their ability to manage their own health and effectively use health services and establish those healthy lifestyle habits. And those aren't going to happen overnight. And that's why we say, if you start ensuring that your teen is going to every well visit starting at age 12 and 13 and beginning to have these conversations and working with your provider on a transition plan, you're half the battle's won right there. So, and then for the provider, they have a responsibility to ensure an organized process that supports effective transition preparation for that shift from pediatric to adult health, and transfer of care to and with adult health care providers. And I know the video pointed out that, if you're seeing a family medicine physician, you're not necessarily going to leave a provider. You are going to stay in the same provider group, but you will be then shifted to an adult model of care. In other words, your family will not receive and are not welcome in your visits unless you give permission. There's some tools that we utilize in our TA with practices on supporting them with implementing youth health transition supports. These are especially important for youth with special healthcare needs or disabilities. And one of them is called a readiness assessment checklist. This was actually adapted from the national, some of the national centers tools. And then the create your own plan, actually, some of the staff members in Region 10, Families Helping Families, who used to support the Family Resource Center, were very instrumental in developing this. This is not the end all and everything, but it is a way to start thinking about transition early on and thinking about the things that as your teen and guardian needs to start thinking about. So you are prepared for that period of transition. And these are the tools that will be shared out to everybody after the thing and after the training. So when we talk about youth transition services, it really is, or should be, a truly collaborative effort. So primary care, home, and school plays a big part, especially for individuals with an IEP. And the goal of all of this collaborative effort is we want that teen to identify their role in youth transition. We want to support that shift of responsibility and gradual. We don't want to dump it on them overnight and overwhelm them. We want to support them in that development of healthy life skills. I mean, they should be getting health education within the school system. They should be getting it from their healthcare providers. And then we want to guide them towards that healthy independence and maximizing their ability. And as always, going back to those top 3 leading causes of death in this population, we want to really make a strong effort to promote personal safety. And we've mentioned a couple of times along the way, because that's all a big part of youth transition in Louisiana. While they are not an adult in all aspects, like you can't, I believe, go buy cigarettes, you can't go buy alcohol. But in Louisiana, the age of majority is 18, and the laws do change. By age 16, families should have key discussions with providers about what's going to happen at age 18, about whether or not the teen is comfortable with the family continuing to attend appointments. Many pediatric centers will see teens until they're age 22. And if that's the case, from age 18 on, it's up to the youth whether or not the parent, caregiver, guardian, whomever is welcome to access their records or participate in visits. And then for those individuals that have a developmental disability, decision-making needs to be thought through. Will your teen need support with healthcare finances or independent living decisions? And so one of the things that have come about in recent years is supported decision-making agreements. They are less formal, and they're found to improve health outcomes for individuals with developmental disabilities. So it really does center the decision-making around that individual with a developmental disability, and they just kind of have a support team. There's a lot of great information, and I'll provide those links for you at disabilityrights.org. They have a really excellent up-to-date document on that. Something a little bit more restrictive is called continuing tutorship, and in other states that would be referred to as guardianship, but that is a definite legal process. It requires an attorney. If it is enacted after the teen turns 18, you will need 2 attorneys, one to represent the the young adult want to represent the family. If it is done before the age of majority, then there is only one attorney required to represent the interest of the family. But it is a legal process. It does have court fees and attorney fees associated with it. So it is something definitely families need to consider sooner rather than later, so they're not caught at the last minute with trying to get all of this processed before the age of 18. And so I think one of the biggest questions when I first dove into the world of youth transition as a parent, I wanted to know, like, where do I start and how do I help my teen take this on? And I think first and foremost, if your teen has a special healthcare need, learning about healthcare and establishing healthy habits for all teens. So what does that mean? And sometimes I know as parents, we don't feel that they're listening. But I always use that seed theory is like, at least I'm trying to plant the seed. And in public health, we have kind of a motto is that we tell them, we share it with them again, we remind them, we tell them, we message them, we keep sending the same messages, and eventually some of it hopefully sinks in. And then learning how to prepare a medical history cheat sheet. And again, this is very important for somebody that has a medical history. If they have asthma, they have diabetes, they have spina bifida, they have undergone multiple surgeries, anything where it's going to take a little bit of effort to compile that information, I recommend creating a medical history cheat sheet. And for those teens that have a smartphone, you take a picture of it, you have it on your phone. It should include your medications, your past surgeries, those types of things. Again, that getting comfortable talking about health and personal needs with health providers, I can't emphasize enough. It takes practice. A lot of times going into even, as a clinician, working with families, working as a case manager, if you set the tone, especially if you act hurried in an interaction, hey, what's going on today? Oh, nothing, everything's fine. There's not the space. They don't feel like there's a space for them to interject. So they have to learn how to really get comfortable with making known their needs with health providers, because they're not, not every health provider is going to walk in with that warm and welcoming, like open-ended statement. How can I help you? What's bothering you today? You need to be able to go in there with your own prompts. Knowing your health red flags, knowing your health condition, what are your triggers? If you have anxiety, what does that look like? What calms you down? What do you need to know to take care of yourself in the moment? Medications, if you're taking any type of prescription or non-prescription medications, you need to know how to manage those. And by about the age of 16, that young adult should be able to do that pretty autonomously, unless they have a developmental disability that is significantly impacting. But I would say practice, practice, practice. There's lots of tools out there, medication kits where you can walk through. There's even ones that have alarms that go off. So really, really lots of great technology since over the last 10 years. There's been so many tools that have been developed. They're amazing. And they're because they're like becoming a part of part of medicine, mainstream, I mean, they're becoming much more affordable. Like on Amazon, you can get these devices really inexpensively. Reliable health information. So that is something that has become a big thing with the internet. So sometimes we need or want questions answered quickly, and the internet has, for good or bad, become the go-to resource. But let me just remind everybody that your personal health provider they are often the best resource because they know you, they know your history. So if at all possible, I would say they would be your go-to. But if you're looking up something, just want to learn more about a topic, it is important to evaluate what you find on the internet because just anyone can literally post information on the internet. Search engine results are selected by computer software, not by human experts. Websites may be sponsored by companies that are selling products and may provide biased information. So just some quick tips, look for sites sponsored by .gov, educational institutions they have a lot of centers of excellence, a lot of research. So .edu is usually a reliable resource. Credible professional organizations, .orgs, they're more likely to provide unbiased information than commercial websites that are trying to sell you something. They are going to slant the information that they provide to you to get you to buy or enroll in whatever they're promoting. And then always a quick and easy way is check the About Us page of a website. It should provide transparent information on the site host, the organization, who funds them, what is their mission, vision, goal, that type of thing. And to me, that's the first thing I do when I go on a website is like, what is their angle? What is their mission? What are they trying to accomplish? And does it resonate with kind of what I'm looking for? Healthcare and disability insurance. I know everybody's seeing the commercials. Please, if you know anybody, I know I'm probably speaking to the choir here that has Medicaid. They are doing redetermination, so that just means you have to requalify, provide income information and that. So please, if you're getting letters, don't let those slip by. Social Security insurance. One thing for transition, I want to assure everybody, everyone gets redetermined at age 18. A lot of families, when I was working with families more closely, they would get alarmed. They're trying to take our benefit away. It happens for everyone. So your child is approved for Social Security disability insurance based on child criteria. At age 18, they have to meet the adult criteria. It is not, you are not being singled out in any way. It's just the process. Once they do, if they're redetermined, they have meet adult criteria, they will be eligible for lifetime Medicaid. So it's important if you really feel that if you get denied the first time, the advice is apply again. If you feel like you or your child or family member meets that disability requirement, it's really important. Private group insurance. Just know that employer-sponsored insurance programs, you can keep young adults on your plan through age 26. And if they have a significant health condition, disability, you can advocate and request that they stay on indefinitely. A lot of families don't know about that. Health insurance marketplace. So say you're making more money now and you're not eligible for Medicaid, you can find really affordable plans on the health insurance marketplace. And then a lot of times eligible individuals will receive tax credit based on your income that'll apply for premiums. So that's a good place to look. As far as insurance plans and insurance cards, that is sometimes an overlooked resource. On that insurance card, there's a web address, there's provider lookup tools, so you can instantly access who is in your plan to identify new providers. There's customer service contacts, there's pharmacy help desks, authorizations, mailing address. So all of that information, and if you say you receive one card for your family and everybody's on that same plan, I would recommend that your young adult take pictures front and back and keep a copy of that in their phone if they have a smartphone. Oops. Prior authorization, just quick about that. They're required for some meds, therapies, and medical equipment. They follow an established approval pathway. If you receive a denial notice, it has to say why it was denied. It's denied based on a benefit rule. Engage care coordinators, nurses, therapists, anyone on your healthcare team to facilitate prior authorizations. I can't tell you how many times I've worked with families. Once I've called an office, it's like, Oh, yeah, we ordered that, and come to find out, the prior authorization got stuck on somebody's desk and it didn't get filed or processed, or they received something that they needed more information. So squeaky wheel gets the oil. If you haven't heard back on prior authorization, keep following up and checking. If denied and you and your team feel that this treatment or equipment is needed to manage and support a good health outcome, you can appeal. And that's a good opportunity for teens to learn about how to advocate for their healthcare needs. The appeal process should be on that form. Taking medication correctly is essential. Many tools are available. This is a snapshot. This is for a resource from prescriberoutreach.org. And I know adults, for me, I pick up that prescription bottle and I don't even think twice about the amount of information that is on that prescription label, and teens should become familiar with that. Some teens, and I can tell you this is personal experience, my own private study, 4 kids. I would venture to say at 18, none of them called in their own prescriptions. And it took them a minute to figure it out. So this is something, it's just looking at it, talking through it. And if you have any questions, your pharmacist is a great resource. Healthy behaviors, food and nutrition, a lot of good resources. I love the Start Simple. If you go to the MyPlate website, it really breaks down some simplified strategies to eating better, like improving. We all know that fast food, which our teens and soccer moms love only because it's like quick and easy, is not always the best choice. So if we want to kind of start shifting the way we're eating, Start Simple with MyPlate Today. It really is a great resource. Active lifestyle recommendations. There are recommendations, believe it or not, teens, if they have no restrictions, should have about 60 minutes of moderate to vigorous exercise daily. And those benefits include improved academic performance, brain health, muscular fitness, heart and lung. So CDC has a lot of good information. And so even for physical activity, for individuals with chronic disease. So please check that out. So I've got to probably the meat of the presentation is like some resources that will help you support yourself, your teen, or other families with youth transition. So smoothmovesYHT.org, that is the website that was part of my doctoral work. So truly anybody can publish something on the internet. But I promise you it is totally evidence-based and comes from research and best practice recommendations from the AAP, the adolescent medicine groups, and such. But it supports teen identification of their transition role. There is a plethora of Louisiana-specific resources. It covers all topics of transitions. There's really cool video and content and tools from centers of excellence around the country. And we're hoping, we've purchased teenhealthhub.org. One of the things about smoothmovesYHT.org, the name is kind of shooting ourselves in the foot, because if you don't know what YHT means, then you have no idea what this website will bring you. So Department of Education, so any teen that has an IEP should have a transition service plan by age 16. So that coordinated transition services is defined as a coordinated set of activities that promote movement from school to such post-school activities, post-secondary education, vocational training, employment, adult services, independent living, and community participation. So if your teen has an IEP, make sure, check in and ask for documentation of that IEP transition plan. Reliable legal information. Y'all, the Louisiana State Bar Association has a plan, a page dedicated to becoming an adult in Louisiana. Excellent resource. driving, voting, military, jury, alcohol, housing, contracts, education, employment, credit, parenting, criminal charges, public, web, and services, all are covered from the legal experts in our state. So that is, to me, that is a really great resource. Legal support. So Disability Rights Louisiana, I mentioned them earlier. They're the ones that publish that document on supported decision-making agreements. A lot of great information there. Again, you'll receive the PowerPoint with links to these organizations. College University, there are less supports available at the university level, but there is an Office of Disability Services. If your child or youth needs some type of accommodation, I'm talking about the day you go into orientation, go find out where that office is located and do face-to-face meetings with those individuals and make friends. They will help your youth have a successful encounter in the college or community college setting. Family Resource Center can't promote this enough. I mentioned it before. We will help any family in Louisiana with just about anything because we are a holistic service that addresses the physical, mental health needs. We provide what we call like level 1 care coordination. We will help with resource linkage and connecting them to the services and supports needed. We will help them navigate the early childhood education system, identify resources for that, and also insurance. So just about any need, a family can reach out to us, a provider can reach out to us, a community organization can make a referral. Anyone's welcome to contact us. Office for Citizens with Developmental Disabilities, community support programs for people with developmental disabilities. They manage the waiver programs. There are flexible families funds, resource centers, a plethora of resources there. If your youth has a developmental disability. Vocational rehab services. Can't say enough about this. Louisiana Rehab Services, sometimes you'll hear them referred to as LRS. They serve persons with disabilities with vocational rehabilitative services. They provide employment support, assist with achieving independence in the community, and cooperatively works with businesses and other community resources. They do great work and it's a great resource, and I believe teens can start working with them at age 16. Exceptional Lives, this is a web-based resource. It's kind of like if you can't sleep at night and you have a question, there's a lot of good resources on there. I personally have partnered with this organization. Really great mission, easy to use, easy to navigate. They have a planning the transition to adulthood, life with disabilities after high school. I really encourage everybody to take a look. Last but not least is natural and community supports. Remember and think through if our individual that we care for has some really complex medical needs or a developmental disability, ensuring that they have a circle of support. There's a really great manual. It was developed by, I think, a group in Australia, but it's really like a formal how-to manual to develop that circle of support across the life course. So it's a really great resource. Check it out if you have an interest or need. And then, of course, our community organizations and supports. Families Helping Families do so much in the transition space. If you're not connected with them and you have a teen with a special healthcare need and want support with transition, please contact them. Our Developmental Disabilities Council, if you have a concern that's something in your community, a policy that you're concerned about, great place to raise those concerns too. Department of Recreation, finding out what community resources are available to you. Of course, there's always specialized advocacy and support groups. The NAMI is the National Alliance on Mental Illness, the Spina Bifida Association, Autism Society. There's a Down Syndrome Association, YMCA. I know I've worked with the YMCA as a public health partnership. A lot of individuals were coming to them and saying there weren't community activities for the family to engage with their child with a special need. And they have, I know in the greater New Orleans area, they have worked very hard to add inclusive activities so that these families find a place for recreation. And thank you for joining, and I will now be happy to take any questions, even though we were kind of out of time.
And that's quite all right. Thank you, Patty. That's a lot of information. I also dropped a link to our Families Helping Families of Greater New Orleans website. We have a page specifically for transition resources. We have another page for post-secondary education resources as well. So y'all can check that out if you grab the link that's in the chat box now. And I also dropped the link for our brief little survey that you can take. If you'll click on that for me, I'd appreciate it. Any questions? You can open your mic or you can put them in the chat box.
I think there was a question about what devices are they using, and I'm wondering if that was in reference to like the medication reminders.
No, that was me. I was responding. Someone said they couldn't see the screen and I asked her
Oh,
what
okay.
device she was using, but I think
Oh,
she
okay.
fixed it.
That clears that up. All right.
Sorry. Anyone else? I know that for my family, Patty, the transition, the healthcare transition was rough, and we're still going through it. So anything that that we can have that helps with this, if you have a child who has significant healthcare issues in particular, has a complex medical history, it's just a really hard thing. My son's 25 and a half. He's almost 26, and we're still just kind of settling into the adult healthcare. So we really appreciate all the information and the resources. I will look forward to getting this PDF of the slide deck so that we can have those resources at our fingertips. That'll be very helpful.
Awesome. Well, thank y'all for the opportunity. It's always great partnering with Families Helping Families, and I'll look forward to seeing y'all at the next event.
Thank you so much, Patty. Everyone have a great day.
Bye-bye.